Greetings from Selian Lutheran Hospital and the new Arusha Lutheran Medical Center in which we're sitting today. It's a pleasure to have an opportunity to share with some of you who've been friends and supporters of this work for many years, and for those of you who are new to it. Occasionally it's really good to have the opportunity to see some of the work that we're involved with, either personally if you can get to Africa, or through this gift of video and film. So it's a real pleasure to have an opportunity to share with you today some of what we're involved in and some of the work that we're progressing with now. Many of you know we began working in the Selian Lutheran Hospital and developed it from a small clinic into a full hospital over the last 20 years. In that process, we developed a lot of specialty capability, recruiting a staff that's now extremely well prepared, extremely qualified in their ability to provide health care. In the last 5 years, we've been in the process of trying to develop the new Arusha Lutheran Medical Center to be really a high-quality care specialist hospital serving the whole city of Arusha here in Tanzania. Throughout this progress of developing two hospitals, one which is a specialty and one is more of a community-centered hospital, we have always tried to remain sensitive to the special needs in the community around us. We've been committed to serving the poor, to serving the marginalized, to serve the forgotten. And within the context of healthcare, that's meant for us a holistic ministry to provide physical care, emotional, spiritual, and mental support to the people that we are working with. It's meant that we have preventive services as well as curative services. And that commitment to serving those with special needs has made us particularly sensitive to the forgotten parts of our community. And that has given rise to some of our special projects. And so we now have work particularly with crippled children and disabled children through orthopedic outreach. We do a great work with children who are born with abnormalities like cleft lip and cleft palate, or who have suffered nasty burns and end up with contractures of a joint as a result. And so through plastic surgery, we reach out and help those children be restored to wholeness. We have a program that's particularly focused on women who have had birthing injuries and as a result have become incontinent, and to be able to operate and restore them to wholeness and bring them back into their families is a great ministry and a great gift that we have to offer into the community. More recently, we've become involved heavily with response to the HIV and AIDS epidemic in Africa. Severe problem for us here, and our program covers a spectrum of care from prevention to treatment to caring for those who are left behind when patients or people die of this disease. And that in turn has given rise to a wonderful ministry in hospice care, end-of-life care, which is a home-based program where together with our volunteers, we're now serving upwards of 3,000 people in their homes as they struggle with chronic and life-threatening diseases. At the present time, we continue to explore, and we're in the process of developing a new program here for victims of sexual abuse in this community, and we expect that to open in the next month or two. It's an exciting extension of this commitment to serving those who are forgotten, who are marginalized, and who are the poor in our community. So as we have begun a good work, we see that God has been faithful in bringing it to completion. We started a good work at Selian that is a full-service hospital now, which in turn has spawned another hospital that can allow more specialized care, can allow us to present our patients with the opportunity for more technological care, and to become a teaching institution. And so it's with great pride that we have just recently opened a new training college within the hospital for training assistant doctors, assistant medical officers here in Tanzania. So our goal continues to be to provide competent and compassionate care, to be about treating, teaching, and researching the needs of this community. And you have been a part of this, and you continue to be a part of it, that as we serve the people of Tanzania, we serve them together. So it's a pleasure to share with you today some of the thoughts, some of the ideas, and some of the pictures of the ministries that we're involved with together. So thank you all very much for your support, and we continue to need your prayers and your love and your concern. Thank you, and God bless you.